talk about in Module 11 is the provider enrollment form. This is important. Why is it important? Because provider enrollment form is where you're going to put all your information pertaining to you and your business, the services you provide, the hours of operation, type of vehicles that you have, and the type of clients that you're going to service, right? So this is letting the state know, okay, well, um, J&J NMT Transportation is providing wheelchair services in the Dallas, Texas area. And so this is basically you're going to get put into a database, and it informs the state that you are a licensed and certified uh, non-emergency medical transportation owner. And so the provider enrollment form is basically you informing the state that you're in that you're providing transportation services for the healthcare industry. So this particular application is done through the state. It is free, and we're going to walk you through the process of a application. We're going to go through a application so you can see basically what they ask of you as a business owner. And so, like I said, it's pretty straight to the point as far as the information that they ask. But I just want to give you the gist of why do we have to fill out this application? Because it's important for the state to know what are you offering and what type of business that you have, and if you have the right qualifications, such as vehicle insurance um, and certifications, like past certifications and things of that nature, if they're required in your state. So we're gonna go to the next video, and we're gonna go over in a demonstration on what to do when you're filling out this provider enrollment form. See you on the next video. Provider enrollment form for your particular state. We're just going to give you some basic information so you will learn where to go and what type of information to fill out. I will go over that briefly. So, the first thing that you're going to need to provide is name of the company, type of vehicle that you have, how many vehicles, right? You need to know if you're providing services such as ambulatory, where you're transporting with a uh, vehicle such as a Ford Taurus or a uh, Honda Accord, Chrysler Town and Country, Dodge Grand Caravan, any type of vehicle that's a four-door vehicle that can transport a person. Or you can be the wheelchair service where you're also offering, you know, wheelchair assistance, gurney, stretcher, and those type of vehicles. Also, the hours of operation type of services that you provide, how much your rates are, um, hours of operation, how many vehicles, how many drivers that you have. State's going to want to know this because when Medicaid reaches out to different services, people reach out to Medicaid to get per transportation, then they're going to need you as a provider, whatever county and state that you're in, to provide that service. And this is a way that they can keep track of all the NEMT companies in your state. And for example, we're going to go over this is New York, so transportation provider. And what you do is you go down to non-medical and you click here. Now from there, transportation provider, and here's the business enrollment form. Let's read this. This is just to give you a general idea of what's going to be required in the state of New York. New York State Medicaid enrollment form. Thank you for your interest in enrolling in state Medicaid as a provider. Okay, so here are the instructions. First, this will be new enrollment. So applicant business name, T N T transportation. MPI number 2, 3, 4, 5, 6, 7, 8, 9, 10. Your EIN number 88-908741. Okay. State of licensure, if not New York. So if you have a license number or anything that's pertaining to, I'm not sure what the exact requirements for New York, but if you do have that and it's required, you put that information there. You don't have a DEA number because you're not a doctor. Are you enrolled in Medicare? More than likely, no.
correspondence. So attention to who you would be. Dante Harris, street address 1515 Ridge, Detroit, Michigan, 8227 County. Well, this is for New York, so you'll just put your information in there. So I'm just giving you a general idea how to fill this particular information out. Pay to address, whatever your address will be, will go here. City count, corporate address, same thing, right? So service address, do not list a patient's address. So services rendered to Medicaid patients at your service address may not be billed through any other provider number, okay? So wherever you are providing service to, if you're dropping them off at a medical facility, you're going to put that information there. If the applicant is a pharmacy laboratory, okay, we're not going to put anything here. Disclosing entity applicant. Disclosure ownership and control. So if you are the owner of the business, you're going to put your name, your title, your date of birth, percentage of ownership, your social security number, and all that goes here. Your NPI number goes here. No, we said 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 numbers. Social security number 5, 6, 5, 1, 2, 3, 4, 5, 6, 7. There you go. The EIN number for your business entity, it will go there. Corporation, your corporation information goes here. We're not filling out any information pertaining to a individual. It'll be all entity. Ownership of disclosing entities. Ownership of subcontractors. This is pretty detailed. Wow. I see they ask for a lot of information in New York. But you'll fill out all the information pertaining to your business and agents, managing employees. So if you have somebody that's a manager of your operation, it will go there. And this is just additional, employees in your business that you'll have to list. Have any of the individuals been terminated, denied enrollment, suspended, restricted by, and then you just answer the questions appropriately. If any individuals have ever been convicted of a crime, okay, you say no. Hopefully, if not, then hopefully they have expungement, or they have the clean slate. And yeah, this is how you fill out the provider enrollment form in New York. But other states, it's basically something similar. All right, so where are we at? There we go. Continuation of the provider enrollment form application. So we're on North Carolina now, and we can just NC checks provider enrollment. So this is what they require. Providers must provide services only after they are enrolled as any North Carolina Medicaid or NC Health Choice provider. So they have to be enrolled in order for them to receive services, especially for Medicaid. So NC Medicaid will consider specific requests for retroactive effective dates. Okay, so you can just go over this. And if you want to get started, what you do is you NC Tracks provider enrollment form. And this is where they're gonna take you to a different website, or a different page where you have to create your username and password. Some states require you have a username and password. Other states just require you to just fill out the information, such as New York. Now, if you want to get started with enrollment. Click here. You may begin your provider enrollment online application here. This is the NC Tracks web portal. Contains information that is private and confidential. Only users of legal age or with parental consent authorized. Okay, so you got to create your username, password, and they'll take you to the application. And this is basically the simple process of submitting information for the provider enrollment form. and I'll see you on the next video.